Good afternoon and welcome to our daily media briefing. Our lineup today will be Supervisor Fletcher batting second and providing an update on the informational charts and graphs, and Dr. Wooten will be batting third with an update on our medical cases, and then we'll get right into the question and answers. As you've all seen, the weather has been typically spectacular here in San Diego the last couple of days, and we're anticipating it to be warm and sunny all weekend. I know everyone is itching to get out, but I want to emphasize that we still need to prevent large gatherings and maintain social distancing. Unfortunately, we're going to hear today about a continuing jump in the number of cases, so we've got to remain vigilant a little bit longer. We've asked for your patience in getting us through this critical month of April, and we're almost done with this month. We understand you're tired and you're very eager to use the weekend and the opportunities to get out and enjoy civic life as we once knew it. We hear you, and we said these last few days that we are thinking and planning for that possibility in the very near future. We're actively looking at how we can loosen restrictions at the end of this month so we can breathe a little easier. But we need to follow the medical data and federal and state reopening guidelines. Please remember that we're dealing with a deadly, contagious disease that scientists are still learning a lot about. We can't afford to act recklessly and without a plan, only to suffer a huge setback that will prolong all of our misery and agony. So let's stay the course, San Diego. Short-term pain for long-term gain. We ask for your help and cooperation. Now please welcome Supervisor Fletcher.
Thank you and good afternoon. I want to provide a couple updates on a few things in addition to today's numbers. I want to reiterate every day since the beginning of this, we've said that the day-to-day numbers are less important than the general trends. You need to see a trend and trajectory over time. You also need to really have time to understand and analyze that number and what it means. 2 days ago, we reported our highest number of cases in over 3 weeks at 109 cases, and today is another challenging day. Today we are reporting 152 new positive cases, which is our single largest number of cases to date. But we are reporting 152 new positive cases on the same day. We are reporting a significant day-over-day jump in testing. In the same period, we're reporting 152 positives. We're reporting 2,255 tests. And so while the numbers continue to be erratic, what we know is that we need to continue to hold the course and hold the line. Today, we are reporting 3 unfortunate losses of life, which brings us to 100 total deaths for the county. And what all of these numbers tell us is that we have to continue our focused month of April being one of action and one of commitment, one of daily effort and focus around slowing the spread, around building the foundation, putting us in place to begin to reopen. We also know that we must continue to plan for that reopening. And we want the public to know, as Supervisor Cox mentioned, that we want to open our beaches, we want to open our parks, we want to get folks back to work, but we have to ensure that we are doing it under the guidance of the federal threshold that's been outlined, under the direction of the state criteria that have been outlined, and at a time and point when we believe it is truly in the best interest of our entire county. It would be a great disservice to the citizens of San Diego County if we were to loosen only to see a relapse or a second wave that could trigger us back into intensive restrictions and stop any prolonged economic recovery. And so we are working every single day to prepare and be ready to turn the dial, to ease the restrictions, to move, to do it in the appropriate way at the appropriate time. And we ask for your continued patience. We ask for your continued commitment. The actions that each and every one of us take every day is what will put us in a position to be able to turn that dial and open. I want to say a special thank you to the coastal mayors and the lifeguards who put together a suggestion from their perspective of a phased reopening of the beaches. I can tell you that we would like to allow people to get back into the water, particularly as the temperature starts getting warmer. We are evaluating that proposal. We are also monitoring the daily totals and what they mean as a percentage of testing in order to be able to achieve at least that initial step of letting people get in the water as soon as we possibly can. And so we ask for you to continue to hold fast and know that when appropriate, we will take every reasonable step that we can to ensure a little bit greater access to the things that we need, in line with things that we may do to also increase our public health. And so, again, continue to hold firm with us, continue to work, continue to see through the month of April, and know that there is a light at the end of the tunnel, and we will be able to get back to normal. We just want to make sure that we do it in the most responsible way. Yesterday, the governor talked about a change on elective surgeries, and to be consistent with what the governor is doing and to be responsive to the situations that our health systems face. Today, we are modifying our public health order as it relates to elective surgeries. It will now read that hospitals and healthcare providers shall take measures to preserve and prioritize resources. Hospitals and healthcare providers may authorize and perform emergent or elective surgeries or procedures based on their determination of clinical need and supply capacity and where consistent with state guidance. And so it is an attempt to give hospitals the flexibility to do things. Sometimes things that we consider elective are essential. Sometimes if you delay those too long, they become emergent. And so we want to ensure that we are giving our hospitals and healthcare providers the flexibility based on their clinical needs, their supply capacity, in order to be consistent with state guidance that has gone out. I also want to report, we're pleased to announce that San Diego County has received $334 million in CARES Act funding. I want to thank the hard work of our congressional delegation and the federal administration for providing these funds. This will go a long way towards helping our region respond to the challenges in front of us. We continue to work with the federal authorities and administration to fully understand the proper parameters of how these funds can be deployed and spent, but we are appreciative of the effort and the actions, and we will keep you updated on that. Lastly, I want to talk for a minute about testing, which has been a source of great interest and concern, not only to us, but to so many of you out there. We have a testing task force that stood up. Yesterday, I walked through the parameters of what we were working to do. The priority focus of that testing task force is to comply with both the state and federal guidance that you have the appropriate capacity of testing, of tracing, and of isolation as a needed component of any easing or reopening. It's important to note that when we talk about capacity of testing, in order to truly have the capacity to do a test, you must have all of the components needed to actually execute that test. An analogy that's been used often is that of a printer. You may have a printer, and that printer may be capable of printing 10,000 sheets of paper a day. But if you don't have any paper and you don't have any toner, you don't really have the capacity to have that toner do 10,000 sheets of paper a day. And so all of the various components that go into executing on a test are a vital part of understanding and achieving that capacity. Our testing task force is working with all of our regional partners, our healthcare systems, our hospitals, our clinics, in order to come up and determine what is the number of tests we need per day for our region to meet those guidances from the state and federal. Do we have all of the components and pieces that go into that so we're able to execute on that? And then what is an agreed upon framework or outline, guidelines of who should be tested in what order? Then when we know that and we believe we're there, then we will work to assess how many contact tracing staff do we need based on how many positives we think we'll get out of those tests. And that is what will give us the foundation to check off that part of the box about the need to reopen and ease, and we continue to do that. At present, what I can tell you is the guidelines that have been put out by the County of San Diego, by the state of California, and by the federal government for hospitals around testing, labs, clinics, everyone doing testing, are just guidelines. They're just a priority ranking. Anyone who has available testing capacity and they would like to go beyond those guidelines is free to do so and can at any time. We've talked with all of the hospitals in San Diego County, and not a single one of them said that guidelines are a limiting factor. What they said is a limiting factor in achieving regional capacity are limitations on reagents, swabs, collection kits, cartridges, staffing, and personal protective equipment. By the way, those are the same limiting factors on every jurisdiction probably on the planet. San Diego County is trying to acquire all of these. Our hospitals are trying to acquire them. We're working with them, and we're doing so in an environment where pretty much everyone, every jurisdiction on the planet is trying to acquire the same number of limited supplies. And so we will continue to proactively work to ensure that we have all of the components that are necessary in order to be able to execute on testing, because it not only helps us with better awareness of what's happening on the ground today, but it also prepares us for the future phases where we're in a position to reopen. And those efforts are ongoing and will continue with a great sense of urgency. As it relates to the convention center, yesterday we had 96 total tested there of the unsheltered individuals and staff. 47 came back negative, 48 are pending, and 1 was considered indeterminate. That brings us to a total for the convention center testing evolution to date of 475 total tested. 326 have come back negative, 144 are pending, and 5 have been considered indeterminate and will be retested. Given the news that we had seen out of San Francisco and Boston and other locations surrounding their homeless shelters to be at almost the halfway point of the convention center capacity without a single positive test is incredibly encouraging. And I think is a great testament to the medical staff and team and the planners of the convention center to ensure that they are screening, they are physically separating, they are monitoring on daily. It is entirely possible we will have positives as we go through the rest of the test. We certainly can't predict that, but the initial results there are very encouraging. Now we will jump into our daily report. The first chart you'll see here reflects the 152 positive tests we have today, which brings us to a total of 2,643. Again, you will notice that 152 it surpasses that of April 2nd, which was our previous single-day high of 146. Next slide on testing capacity, you'll see that we did have a significant increase in testing at 2,255, which is a positive step. Again, we've seen a kind of erratic nature of testing, but we certainly hope to see continued increases here, which could partially account for the higher numbers. On our daily charts there, you'll see the positives, which you will see there at 2,643. You see the change in the doubling rate. Again, the doubling rate is a 5-day weighted average weighted by exponential growth, so we're now doubling every 18 days. You see the estimated number of recoveries. Hospitalizations were 23 new hospitalizations for a doubling rate of every 19 days. ICUs is an increase of 7 for a doubling rate there of every 21 days. And deaths was an increase of 4, taking us to 100 total deaths with the doubling rate there of every 7 days. Modest changes in number of hotel rooms, slightly down in public health rooms, although those need and must remain available because they are a critical component of the isolation factor of what we need to have in place in order to be able to begin the reopening process. A slight uptick in the regional task force on the homeless rooms and occupied and guests. Outreach efforts, you see, increases in normal 211 nurse calls, epi calls, hygiene kits, hand washing stations and toilets distributed, remaining very reasonably flat. In our personal protective equipment, we saw increases in every single category, but a significant jump in surgical face masks. In the last 24 hours, we've distributed 64,120 surgical face masks. This is a vital component our healthcare system and partners need of personal protective equipment, and I want to commend the staff of the Medical Operations Center for being able to secure and distribute these, along with increases in everything else that you see listed there. And then our ventilator capacity remains in a solid position. 23 of 23 hospitals reporting with 595 ventilators presently available, plus those that we have here in county surplus ready if a surge requires it. With that, I will turn it over to Dr. Wilma Wooten for her Public Health Officer's report.
Thank you, Supervisor Fletcher, and good afternoon, everyone, and thank you for being here today. As we plan for reopening our county, we are utilizing the federal guidelines Opening Up America Again and the Governor's California's roadmap to modify the stay-at-home order. In the guidelines, 5 metrics must be met before states and regions can reconsider proceeding to a phased opening approach. The county appears to be meeting 3 of these 5 metrics. The 4th metric, to your right, is a downward trend of COVID IV cases within a 14-day period, which today is not met. And again, sorry, that is the bottom left metric. We will continue to monitor and ask everyone to stay the course. I know it has been tough, but please stay the course so that we can reach that metric. The fifth metric is the one that's circled in red, and that is related to robust testing. Speaking of testing, there is a lot of questions that we've received recently. Testing is part of the indicator number 1 that is part of the governor's roadmap. And this is the ability to monitor and protect our communities through testing, contact tracing, and isolating those individuals who are positive or who have been exposed to COVID-19 positive individuals. Please indulge me a few minutes so that I can go through a timeline related to our activities. On Monday, April 13th, as health officer, I made the recommendation to the CEOs and our weekly meeting with the local hospitals to form a laboratory testing task force. And this was announced on Friday, April 17th. Additionally, county identified staff to monitor pop-up drive-through programs occurring in the county, which is being coordinated through our Medical Operations Center. The Medical Operations Center and our public health laboratory staff continue to work together, and as part of a larger task force steering committee led by our public health laboratory director, they are keeping an eye on these activities and working with Dr. McDonald to develop a protocol or process for approval of these types of activities. So since the COVID-19 crisis began in early February, the county has promoted the federal recommendations for testing. And on this slide, you'll see in the second column to the right, those are the federal recommendations, and these are priority levels, priority 1, 2, and 3. And I'll just briefly go through the federal priorities. Priority 1 is hospitalized patients, and obviously they have symptoms. Healthcare workers with symptoms. Then priority 2 is patients in long-term care facilities with symptoms. Patients over 65 years of age with symptoms. Patients with underlying medical conditions. And then first responders with symptoms. Priority 3 includes critical infrastructure workers with symptoms, and healthcare facility workers and first responders, and individuals with mild to moderate symptoms in communities expressing or experiencing high levels or high numbers of hospitalizations. Individuals without symptoms were identified by the federal government as not being a priority. In the middle, these are the state recommendations, and these came out on April 19th. They further support the federal recommendations and include asymptomatic residents of long-term care facilities, community-based testing of all low-risk symptomatic individuals, and surveillance testing of asymptomatic persons. On April 20th, Public Health Services, we also established our own criteria in efforts to expand testing opportunities. And the Laboratory Testing Task Force Committee will meet on Monday next week as well as Wednesday and Friday, and they will use the draft action plan that we have developed at hospital laboratories as well as federally qualified health center laboratories to achieve the region's testing capacity. As a part of that overall objective, we also want to implement a countywide rapid testing program, and the county public health laboratory will implement the Panther Fusion platform in our public health lab, and we anticipate that we will go live with that tomorrow. The second primary objective of the task force will be to implement a countywide serology testing strategy, and last, to implement quality assurance measures for testing the general public, and this is related to the pop-up clinics. A prioritization plan for testing has been developed, as you see here, based on, again, federal, state, and county testing criteria. And these elements were included in our 14th KHAN that was issued earlier today. I also would like to announce that in response to the governor's 6th indicator on testing and part of the statewide plan for reopening, the County of San Diego is expanding drive-through testing locations. The sites will be in Escondido and Chula Vista beginning on Monday, April 27th, this coming Monday. The expanded testing will help to meet the needs of the new priority populations that we've shared with you. Tests will be scheduled and offered by appointment only, and the tests will be conducted by our public health nurses, and we will use our public health laboratory for testing. The hours of the sites in Escondido will be 10 a.m. to 3 p.m., and in Chula Vista, 1 p.m. to 7 p.m. Now, I would like to thank the hospital CEOs, the hospital chief medical officers, and the San Diego County Hospital Association of San Diego and Imperial Counties for their support to work with hospital laboratory directors to obtain information, to look at barriers to testing, and to develop a strategy to expand testing opportunities. Testing is closely related to contract tracing, and we will share our strategy on this task in the coming days. So today, I would like to now share with you the global, national, and state statistics based on data that has been obtained from the Johns Hopkins dashboard at about noon today. Globally, we are approximately to 2.7 million positive cases, including 187,000 deaths. Nationwide, we are at 856,000 positive cases, including 47,000 deaths. For the state of California, approximately 38,000 positive cases have been reported, and this includes 1,400 deaths. And today, the County of San Diego is reporting 2,643 cases, which is 153 more cases than yesterday. This includes 100 deaths, which is 4 more than reported yesterday. Of the 9 additional deaths, these include 2 females in their mid to late 70s and 2 males in their late 60s and 70s. The additional deaths had underlying medical conditions. Of the 2,643 cases that we are reporting today, the age range remains from 3 months to 100 years of age. The percentage of those that are 20 to 49 years of age holds at 51%, and the gender distribution also is approximately 50-50. There are 4 individuals, which represents 0.1% of the total number, that have not had a gender identified. Of those, of the total number, 634 or 24% of cases have been hospitalized. 213 or 8% of the total have been admitted to the ICU. This number is 34% of the total number of those hospitalized. Lastly, the 100 deaths represent approximately 4% of the total number of cases. And the breakdown by race and ethnicity, by city zip code, all of that information is available on our website. Our sincerest sympathies and condolences once again goes out to those individuals who have lost their lives related to the COVID-19 disease. And as a reminder, our website address is www.coronavirus-sd.com. Now, regarding outbreaks, and this will be my last update, regarding outbreaks in congregate and community settings, today we are reporting a cumulative total of 37 confirmed active outbreaks and 1 inactive outbreak, which means there have been no new cases in more than 14 days. These outbreaks include 24 4 active outbreaks in congregate facilities representing 470 cases and 52 deaths, and 13 active outbreaks in community setting locations representing 83 cases and 4 deaths. And today we are reporting 2 new of the 13. From 11 to 13, we have 2 new outbreaks in this group since yesterday. Again, I would like to commend the public for staying the course, but as you can see from today's numbers, we still need to continue to stay at home so that we can decrease COVID-19 in our community. We understand everyone is making tremendous efforts and sacrifice. Our collective efforts are indeed working, but we must continue to stay the course to continue to see a continued decline in our overall numbers. The current social distancing strategies are in place until the end of the month to ensure that we flatten the curve, but we must reassess at the end of the month. So while hope is not a strategy, we are optimistic that the metrics that we are monitoring will trend hopefully in the right direction. Lastly, we have talked a lot about testing today. This week is Medical Laboratory Professionals Week, and today is World Laboratory Day. I would like to thank the laboratory professionals in San Diego County and across the country for their hard work to detect and control diseases, including COVID-19. Now please welcome Supervisor Cox back to the podium.
Thank you, Dr. Wooten. We're going to go directly to the questions now. And again, as always, if your name and your outlet is not identified when we introduce you, please do so. We'll take the first question now.
KPBS, please state your name and question.
Hi there, it's John Carroll from KPBS. I know Supervisor Fletcher touched a little bit on this earlier, but I was hoping maybe for a little more specifics in regard to the plans announced by the mayors of coastal cities yesterday on the 2-phase reopening of beaches. As you probably know, they talked to a coalition of regional lifeguard and coastal law enforcement agencies, and they all approved this plan. So what more does the county have to know or figure out to go ahead and sign off on that plan?
Okay. Supervisor?
Yeah, thank you. I think when you saw the announcement from the coastal mayors, they were clear that they had a phased recommendation, but that the determination for implementing that would be at the discretion of the County of San Diego, and in particular, our public health officer. The reason that those restrictions were initially put in place were to avoid overcrowding. Too many folks congregated in a location, which can help facilitate the spread of coronavirus and COVID-19. And so what we need to see is a stabilization and a trend where we believe that it is not a concern to public health to reactivate or reopen that opportunity. And so we continue daily to assess the numbers, and we would like to do it. We would like to do it really soon because we know that the ability, particularly to get in the water, is something that is an important part of our culture, an important part of our society. It's also an important part of just getting outdoors and enjoying so much of what San Diego makes unique. And so we would like to do that. We would like to do that very soon. But we really have to continue to evaluate the numbers and the cases and where we are to be in a position to do that. I also want to point out that the county public health order only closed the entrances into the water. The actual determination of who can go on the sand is based on the jurisdictions that are in those areas. And so even if the county were to lift the requirement on entering the water, it still would be incumbent upon each jurisdiction to make their individual determination about people crossing the thresholds in order to get those. And we have considerations we're working with the state of California as it relates to state parks. A significant part of our coastline is actually under the control of state beaches and state parks, and so we're talking with the state. I think the goal would be that when we moved, we would have a uniformity of position from the county. We would hope that local jurisdictions would have similar uniformity in terms of what they did. And so we are evaluating their suggestions. We think a phased approach is the right way to go. There may be some changes in terms of what they recommended in their phasing, maybe some things in phase 1 that maybe ought to go in phase 2. You can imagine a situation or scenario whereby you may say, hey, it's okay to get in the water, to swim, to kayak, to paddleboard, to surf, but maybe motorized boats, because it's really hard to physically distance in that environment. It's almost impossible to ensure compliance with who's a household unit. Maybe some of those things get bumped to a second phase, but we're evaluating those. We're grateful for the mayors. We're grateful for the lifeguards. We're grateful for their commitment to enforce that phased approach, and we hope to very soon be able to arrive at a situation where we can get there. But again, it is based on the day-to-day case totals and the numbers. Today was a little concerning with the single biggest report. We do take that in consideration, that it was a significant jump in testing as well, but we have to assess and work through all of that. But we want the public to know that we want to open up our beaches and allow you to get back in the water, and we want to do it as soon as we possibly can.
Thank you, sir.
Before we go to the next question, I just wanted to clarify one point. The number of deaths that we had yesterday was a total of 96. We had 4 additional deaths that we announced today, so the grand total is 100, regrettably, but it's 4 additional cases today. With that, let's go to the next question.
Kaiser Health News, please state your name and question.
Sure, hi, and I actually have a 2-part question. Thank you for taking it. My name is Angela Hart, and first question, Dr. Wooten, interesting you mentioned the drive-through testing sites that are coming, the 2 that are coming, as well as the pop-up testing sites. On those, is that testing available potentially for anyone, or do you need to have a doctor's orders? That would be my first part.
Okay, Dr. Wooten.
Yes, we do want individuals to be referred by their providers, but as you know now, providers, you don't necessarily have to go in if you have mild symptoms, or now providers are doing telemedicine, so that decreases the potential for exposure in the doctor's offices, but calling your doctor and letting them know about your symptoms so that you can be scheduled at the drive-through. The pop-ups we'll be planning for in the coming week. We don't have locations for that. These are the mobile vans, but for the actual drive-through, these will be permanent drive-throughs in addition to the one that's already located in Mission Valley. Thank you.
Okay, thank you. And on the other part, I'm wondering, this is a follow-up from yesterday, some of the places, the counties that we've talked to are getting pretty creative with trying to get some of these testing supplies, and I just wondered what you guys are you guys having to get creative? You know, some of the things we're hearing are like 3D testing swabs or, you know, pillaging, or, you know, going to Amazon and purchasing your own stuff. Are you guys having to do some of those creative measures? If you could explain that.
Oh, absolutely. Our Department of Purchasing and Contract person is very active in trying to locate resources, supplies, in particular that we need. We've had local individuals that have volunteered to make 3D face shields. So we are utilizing all of the resources and the innovative strategies that are available to us to increase our personal protective equipment supplies, as well as supplies that are necessary and needed for testing. Thank you.
That completes our calls. We're going to go now to the texted questions. The first one is dealing with homeless and testing at the convention center, and Supervisor Fletcher will respond to that question.
This question is from Lisa Halverstadt. How many homeless people staying at the convention center have been tested versus the staff and first responders who are working there?
Yeah, we still don't have the breakdown of that. We've requested it, and when we get it, you'll be the very first to know.
Okay, thank you.
These next 3 texted questions are all really medically related, and so Dr. Wooten's going to be responding to those. We'll go with the first question.
Yes, we're picking up some more questions on testing, a little bit of clarity. Can you provide an update on the latest numbers for testing capacity in San Diego County? And also, we see that testing capacity is growing, but how many tests would be needed to run daily in order to reconsider some of the public health orders?
So I'll take the last part first. There's been a recent article that's come out from Harvard University that states that jurisdictions need to test 152 individuals per 100,000 populations. And for our population of 3.4 million, that would equate to 5,168 tests on a daily basis. So that is one of the goals and charges of our task force, to look at, number one, what is our current capacity? And again, we are thankful to the Hospital Association of San Diego and Imperial Counties for working with our public health laboratory director to identify first what are the barriers to testing. And then the second charge that they have is to look at and to really codify what is the actual testing capacity. And then once we know, really have a handle on that information, then we, again, following the priority testing areas that I've reviewed with you already, and each entity will look at where can they expand their testing capacity. And I've shared with you what the County of San Diego, what we are doing in terms of expanding testing, the additional two drive-through locations in North and South County. And also, we plan to have the Live Well mobile van go around to hotspots, if you will, so that we can test those targeted populations that we have identified.
And so for the first part of the question, is there a number of our testing capacity right now?
Well, right now, as we reported from the Board of Supervisors, at the Board of Supervisors meeting on Tuesday, we are at about 3,058. We can test in the public health laboratory about 1,000 plus. We've identified hospitals at about 3,000 plus. And then the commercial laboratories are a little less, while they have a 23,000 capacity nationwide. Locally in San Diego, it's a very small portion of that. But again, that's why we really want to codify what are those actual numbers across the system.
Okay, thank you. And this one is from Monica Dean from Channel 7. I understand we're waiting for numbers of positive cases to trend downward to meet federal metrics for reopening. But wouldn't it be realistic to expect the number of positive cases to continue to rise as testing becomes more widespread?
Well, absolutely, but if testing becomes more widespread, what we want to see is, of the tests that are conducted, that a larger percentage of them are negative. We want to, but again, at the very early time or early part of in the late February, we had limited testing supplies because we only had the CDC test kit. It was missing at times reagents. And over the past 2 weeks, we got up to about 1,500 2 weeks ago when we presented to the Board of Supervisors. And at this last meeting, we reported about 3,000 plus. So we want to increase testing, but hopefully, as we see overall positive tests, the number of overall tests will, the percentage of the positive will be a smaller proportion of all of those tested in any one given day.
Okay. And this one is from KUSI. How many COVID cases have been put on ventilators? And of those, what percentage have survived?
Well, I don't know that number right this moment, but the information is on the CDPH's website, and it lists daily because the hospitals have to report daily to the state. So that information is on the state's website. We have sent that email address out before, and we can send that out again after this briefing.
And then I have a question. This one is from Cliff Albert at COGO. Is there any evidence that possibly, like the flu, the much warmer weather, as we are having in the next few days, has any impact on the life or spread of COVID-19?
We just don't know the answer to that. You've been seeing on the news that there may be potentially a much larger wave in the fall. But again, this is a novel virus, so we don't know the true characteristics of its behavior, so we will just have to wait and see.
Okay, and I have one more, and this is from Kimberly Hunt at 10 News. You mentioned pop-up testing sites. How would a doctor get someone an appointment at one of the sites?
So let me rephrase, because usually when we say pop-up testing sites, it's kind of the, for lack of a better word, but the sites that have not gotten approval from the county. We will have permanent drive-through sites, and then we will have mobile van sites. And that might be, you could equate that to a pop-up, but it will go around from area to area, depending upon the hotspots that we've identified for testing. So the question is,
How would you get an appointment
yes.
at one of those sites?
So we haven't identified where those locations are yet, so we will have that information for you just as we announced the permanent drive-through sites today. We will have that information available for you hopefully next week. But in any case, you can always call 211 with any of the services related to COVID-19.
And I think she was asking in relation to the county shut down a COVID-19 testing site at Maricosta College. Emails went out to those who had registered there saying they were moving sites. They encouraged those who had not gone to that site to go to the new site. So what should people know about who to trust with the sites?
Well, again, if there are pop-up sites, number one, call your doctor. You can call 211, and we will have information available about pop-up sites. That is one of the also charges of the task force. We are working to develop a protocol that will be posted so that people, if they have questions, they can call and find out where these sites are and if they have been approved by the county.
Perfect. Thank you.
That concludes the questions for today. Before we leave, though, I wanted to acknowledge that Supervisor Gaspar held an event today up at Palomar Hospital where we actually stood up the federal medical station, which will provide an additional 202 beds at Palomar that can be used for COVID patients if the need arises. And again, Supervisor Gaspar has been doing a lot of work up there in North County along with Supervisor Desmond. I want to mention two events that are going on this week. We talked yesterday about Earth Day. By simply doing things around the home, you could celebrate Earth Day. Today, what I wanted to do is make note that April is usually the time of the year when the county issues notices about West Nile virus. And yes, even with what's going on with COVID-19, we still have to worry about West Nile virus. So take this moment when you're spending more time at home to prevent mosquito breeding by looking around your home and yard and dumping out standing water from items like plant saucers. Please keep yourself and your family safe by practicing prevent, protect, and report. Prevent mosquitoes from breeding by looking for and dumping out standing water at home. Protect yourself and family by using insect repellent and having screens on your doors and windows. And report dead birds and increased mosquito activity to the County Vector Control Program at 858-694-2888 or email vector@sdcounty.ca.gov or go through the county's Tell Us Now app. For more information about the Vector Control Program, visit sdfightthebite.com. Lastly, this week is also National Library Week, and we want to remind everyone that if you need to keep your family entertained, the county library system is providing digital resources including ebooks, audiobooks, magazines, e-magazines, and learning resources for all ages. To access these resources or to get a digital library card, go to sdcl.org. These are an opportunity really to assess these resources and a way to keep your family busy. And remember that the library is always there for you. With that, remember our motto and our mantra is stay in place, maintain space, and cover your face. We'll be back here tomorrow at 2:30. Thank you.